Good afternoon, everyone, and welcome to the informational webinar for America's Promise Healthy Schools Fund. I'm Tanya Tucker with America's Promise Alliance. I just want to quickly run through the agenda for the webinar this afternoon. We'll give you a quick and brief background about America's Promise Alliance if you don't know much about us. We'll go into an overview and purpose of the Healthy Schools Fund, and then we'll dig into more detail about what we're actually looking for with the applications, eligibility, selection criteria. We'll go through the different content areas for the applications. We'll give an overview of the timeline, and then we'll leave plenty of time for your questions. So let's dive right in. America's Promise Alliance is really about two big ideas. One, that every child should have the opportunity and support that they need to succeed in school, life, and work, and that every adult has the responsibility to help make that happen. And those fundamental resources that we believe every young child deserves, we call those the 5 promises. Caring adults, safe places, a healthy start, an effective education, and opportunities to serve. And we think of the 5 promises as the conditions for success. They're really the essentials for young people to thrive. We're the largest cross-sector network dedicated to improving the lives of children and youth. We have over 400 national partners and over 250 state and community level partners. And we work with our alliance to focus on big goals that no one organization or not one sector could achieve on its own. And certainly making healthy schools the norm for every child is a big goal that we're excited to be a part of. The America's Promise Healthy Schools Fund is part of Together for Healthy and Successful Schools. This is a collaborative initiative of the Robert Wood Johnson Foundation. America's Promise is one of 3 grantees for this initiative, along with Child Trends and Washington University in St. Louis. And as part of this initiative, we seek to activate and align existing and new stakeholders at both the local and national levels to support healthy school environments. So with this grant opportunity, we are looking for organizations and communities working to create healthier school environments for all children. We will award 3 to 5 grants of up to $150,000 per year for 2 years, so for a total of up to $300,000. As part of this initiative, America's Promise is partnering with 5 leading organizations to work with communities to learn about successfully supporting health and well-being in schools. The key learning questions that will guide our work: what factors help or hinder schools in creating healthier school environments? What levers can influence local, state, and federal school health policies? And what are the most effective ways to build public and political will to promote students' health and well-being? By joining this effort, grantees will drive local change while serving as models for national awareness building and learning. Grantees will have the opportunities to engage in support activities to accelerate their work toward creating healthy schools. And those activities include partnerships with content expert advisors, youth engagement expertise, national and local communications support, and access to a learning community. So I'm going to turn it over to my colleague, Nico Connolly, to talk about what we're looking for specifically with the applications. Before I do that, I just want to point out, I mentioned that we're working with some core partners as part of this initiative, and you see their logos at the bottom of the slide, so just want to mention who they are: Child Obesity 180, Communities in Schools, Food Corps, the National Association of Community Health Centers, and Turnaround for Children.
Hi everyone, I'm Nico Connolly and I'm a manager at America's Promise Alliance. I'm going to share more about what we are looking for across applications, and I'll also walk through the grant portal itself and the application process. To get started, there are 6 eligibility requirements for applicants to the Healthy Schools Fund. The first is that an organization can be a public, private, or nonprofit focused on serving children and youth. In addition to the types of organizations listed here, and because we've gotten some questions from folks, it's also worth mentioning that the opportunity is available to community health centers and county departments of education and county departments of health. The second eligibility requirement is that the applicant must be a convener of stakeholders from diverse sectors of the community. Applicants must also demonstrate evidence of prior collaboration with these stakeholders on health or education initiatives. The fourth eligibility requirement is to have school district commitment as a partner. Applicants must show a collaborative relationship with the school district or districts they will be working with. And I'd also say that it's totally fine to work with more than one school district, as long as there is a letter of commitment from at least one submitted via the grant application portal. If the applicant is a school district, please submit a letter of commitment from at least one community partner who will be collaborating on the project. Applicants are also required to have a strong commitment to health equity and serving young people who are facing the greatest obstacles to thriving. To us at America's Promise, this means that every young person deserves a chance to succeed, no matter who they are, where they're from, or how much money their family makes. And we are interested in work and projects that embody those principles. Lastly, and very importantly, the opportunity is available to applicants in the 20 states listed here. We selected these states for the purpose of alignment across the Together for Healthy and Successful Schools initiative that Tanya mentioned earlier. The process for selecting these states really took several factors into account, including physical and social emotional health indicators, chronic absenteeism rates, and key disparities across geographic, racial, ethnic, and socioeconomic status. Moving into the selection criteria, these are the elements that we'll be looking at most closely as we evaluate applications. The first is prior leadership and collective actions to change how systems, institutions, and individuals interact. This should include successes, failures, lessons learned in doing past collaborative work at the community level. We'll also be looking for a compelling vision for how this grant will advance healthy schools in your community. We want to learn about how the project will help to transform school environments, or really create the conditions where schools can be a hub for the broader community and their collective health. The third selection criterion is the extent to which we have a firm idea of how this grant furthers collaborative efforts. Applicants should make sure that proposals provide insight into the specific strategies and tactics that will be pursued with these grant funds. Another crucial component of the proposal will be the approach for authentically engaging young people and other direct stakeholders. In this project, and across all of our work, America's Promise puts youth at the center and strives to create the conditions in which youth and their families can champion change. We'll be looking to fund projects that share this belief and have thoughtfully designed an approach for engaging young people themselves in informing and, if appropriate, guiding the work. One final thing to mention is that the framework we are really looking to when we think about and talk about healthy schools and healthy children is the whole school, whole child, whole community model developed by ASCD and the CDC. We'll be interested in learning how applicants have engaged in different areas of the whole school, whole child, whole community model, and which partners have been helpful in addressing the holistic needs of young people illustrated by the framework. Before diving into the application content, I just wanted to let folks know that if you have any questions about eligibility, the overall initiative, or the selection criteria, please use the questions box in the panel to the right, and we will answer them at the end of the presentation. I'll now talk about navigating the online grant application portal and what the contents of the application itself are. All applications must be submitted via the grant application portal. The link to the portal is available on the funding webpage at americaspromise.org. To use the portal, you will need to register and create a new account. And once registered, you will see the option to access the Healthy Schools Fund application. There is a screenshot of what it will look like inside the grant portal at the bottom of this slide. I'd encourage folks to go in and familiarize yourselves with the portal, even if you aren't ready to start drafting. Once you are in the Healthy Schools Fund application section, you'll see the following sections of questions and prompts laid out in front of you. The first, applicant information. Here, we're looking for you to provide some background information on your organization. There will be prompts for things like main point of contact and fiscal point of contact. This is also where the school district or community partner letter of commitment will be uploaded. The following section is Section A, and it contains 3 narrative questions that are focused on local context and community background information, as well as past collaborative efforts that the applicant has led and been involved in. Section B is where applicants can share their vision for how this grant will accelerate change in their community around healthy schools. There are 7 narrative questions that include questions that address things like, what partners are involved in the proposed work? What are potential challenges and supportive factors in the community? How will the applicant plan to authentically engage young people? And a prompt for identifying potential support from America's Promise and the 5 core partners in this work. I'd also like to mention that the narrative questions will have character limits. And important to note that they're not word limits and they vary based on each question. We also have an appendix section that is a check the box section. Each of the 5 core partners that Tanya mentioned earlier are described here so that applicants can learn more about the organizations, their expertise, and potential areas where they can provide support to grantees. We ask that applicants only check the supports that would be most relevant and helpful to them. And just to clarify, we will not be using this section to evaluate proposals. So please don't feel like the number of supports you check will have a direct bearing on whether or not your application is selected to advance. One of the supporting documents in the grant portal is the budget and budget narrative. In the budget section, you will be able to download an Excel spreadsheet that has 2 tabs. The first is the budget and budget narrative sheet that we hope you will fill out. The second tab will automatically populate when you fill out the first tab, but it's worth double checking to make sure it does so correctly. Both of the tabs are screenshotted on this slide, and once completed, please upload the completed budget into the grant portal. The final component is the scope of work, which will be a similar process of downloading and re-uploading a completed version. The key milestone section is really where we hope to get a sense of some of the process indicators of your project across the 2-year period. Before opening it up to Q&A, I just wanted to share the timeline of both the application process and the grant period. So the next informational webinar will be on December 7th. It will be very similar to this one. And the application itself will be due on January 22nd of 2018 at 8 p.m. Eastern Time. We will then be doing internal and external reviews to select finalist grantees and possibly following up with clarifying questions to the finalists before making a decision with a March 14th deadline in mind. And if selected, the grant period will run from April 2018 to April 2020. So I think we will now open it up to the question and answer period. If you haven't already done so, please use the question box to the right to ask any questions. After this webinar, we will update the FAQ document and post a revised one on the funding webpage. We'll also be sure to include any questions that we don't get to today. If at any point during the application process you have another question or a more specific question, feel free to email healthyschools@americaspromise.org. And lastly, we will be posting these slides on the funding webpage in the coming days, in case you'd like to look back at them. Thank you for listening, and we will now start answering some questions.
So we already have a couple of questions that were in the queue. So one question is, what is the minimum number of schools that an organization must be working with that is considered as a cluster? Very good question. So this grant opportunity is designed for organizations to work with either whole school districts or a cluster of schools. And a cluster meaning we really just didn't want this opportunity to be about working with just one school. So it could be a feeder pattern of schools, elementary to middle to high school. It could be a cluster of schools in a particular neighborhood that you're targeting. So I would think of it as, 3 as kind of a minimum if you're looking for a number. But yes, we really just wanted to avoid, we just want to work with this one elementary school. So hopefully that answers your question. Another question around what is the ideal scale or size of population for this grant? So since hopefully the first question about the number of schools to work with kind of helps answer the scale or size, we do not have determined and you must be working with this number of students as a part of the schools you choose to work with. So that certainly is just based on which schools you target. And because it's not a direct service, direct programming type grant, we have not put, numbers of students served as part of the requirements. But hopefully the answer to the minimum number of schools that you should be working with kind of helps get to that question of scale. Okay, another question from one of the participants. Our school is located in Illinois, but we have students who live in Indiana. Are we eligible? The answer to this is yes, you would be eligible, and it would just have to be clear in your application, which schools you're targeting. But yes, you would be eligible. A question about how we got to the 20 states, and if we could go over again the criteria we used. Nico, can you answer that one?
So the process for selecting the states took several factors into account. The analysis that was done took into account physical and social emotional health indicators, chronic absenteeism rates, and key disparities across geographic, racial, ethnic, and socioeconomic status. And feel free to follow up offline via email if you'd like to learn more about what that analysis part entailed, but it also included some states that were advantageous for the larger Together for Healthy and Successful Schools initiative work, and that's why they're prioritized.
Question about the budget. On the budget summary tab, it asks for a proposal ID. How do we get that information? You can actually ignore the proposal ID tab. That's more for internal use, so please ignore that. Question to see, I'm unclear if statewide efforts are possible with this initiative or if this is specifically for localized approaches. This opportunity is designed more for kind of community-led, localized approaches, although I would say if there's a state entity that really wants to target and focus on, a specific, community or a couple of districts, that would be fine. But we don't envision this as sort of a statewide effort, but not to exclude sort of a state entity really taking the lead to support and focus on a particular community or district. Can there be co-applicants as long as one applicant takes on the lead applicant role? Absolutely. We really envision this as a collaborative effort with, one agency organization taking that lead role. So yes, we'd love to see co-applicants and as many partners involved in this effort as possible. If we are a national organization with programs in multiple states, is it best to focus on preparing an application for one community or submit applications for multiple communities, recognizing our sites will be competing with one another for the funding? That's a great question. I'm sure we'll have instances of this with, lots of interested national orgs that have networks in many of these states. I would say to encourage multiple applications. I'd hate to discourage folks from being interested in applying for the opportunity. So, I think, if you feel that your network and affiliates are ready and, meet the criteria and have a compelling idea and work to accelerate under this grant, I would encourage multiple applications. If a school district and multiple partners are trying to apply together, receiving a single application from the group is better than multiple, right? Yes, that's correct. Again, we know and we really design this to be collaborative efforts, so we know lots of different groups will be involved, but there should be one single application from that group and indicate, who all of the partners are, what roles they're playing, certainly letters of commitment and support welcome from all the partners. Are matching funds from other partners a factor in the evaluation? No, I would say it's not a factor in the evaluation. It's helpful information to have. We see this as funds that will help accelerate work that's happening on the ground. So we know that, some good work is already happening. So for us to get a clearer and bigger picture of, what resources are already dedicated to the effort is great, but it won't be an evaluation factor. If we want to apply jointly with a collaborating organization, what is the best way to do that? For that question, I might need a little more information. Certainly, like the previous question, we're looking for, one joint application from partners. But if this is a question that's more around, you want to be connected perhaps to interested partners in your community or state, why don't you email us and we'll answer that question offline. But in terms of if you've already identified partners in your community, definitely, share the application and RFP with them and then together jointly submit one application. But if it is a question around, needing connections to some potential partners, please do email us offline. Is there any required travel or required collaboration that needs to be addressed in the expense area? I would say that is, there's no required travel that you need to put in your budget. All of the sort of gatherings that are part of the learning community that America's Promise and our core partners will be supporting. We will take care of those travel expenses and expenses that are a part of, those events. So really just put in your budget, if there are travel or other expenses around that, that's just part of your planning. So none that are required because of the grant participation. Are there any limitations to use of grant money? For instance, would capital costs such as construction, remodeling a physical space be eligible? So right now, we have no limitations on the use of the grant funds. If you have a compelling, idea and proposal that you set forth, and we see that perhaps capital costs is really going to help, accelerate the work and move you in the direction and is in keeping with sort of the overall goals and purpose of this initiative, I think that's fine. You're really going to have to make a compelling case for that for capital, particularly capital costs, but it is allowed. So let's see. If a school is currently receiving Creating Healthy Schools and Community funds, are they eligible for this? Absolutely. In designing this initiative, we know that we are leveraging this opportunity on top of other really successful and great initiatives and efforts that are happening. So, being a part of that funding does not preclude you from applying and potentially receiving grant funds under this initiative. Is it acceptable to work with more than one school district, or are you looking for proposals to engage only one district? Definitely acceptable to work with multiple districts. That's absolutely fine. Can more than one entity in a state apply? Yes, absolutely. Could it be a cluster targeting Title I schools? Yes, that would be absolutely acceptable. Is there a specific size of a district? No, not at all. And actually, as we evaluate the applications that come in and look at the portfolio of grants that we want to award, we'll be looking at, getting the sort of most diverse group of awardees as possible. So there is not a specific size or of the district that we're looking for. Are you looking for specific health outcomes for grantees to measure? So as Nico said in the overview, really what we're looking at is, as the framework, is the whole school, whole child, whole community framework. And so the very holistic view of health and well-being and what a healthy school should entail. And so it's really up to each applicant to figure out sort of what key areas they're really looking to move the needle on with this particular grant application. It could be it could be something that the community needs to do to move the needle on, all aspects of the framework, or perhaps there are one or two that you really want to target as part of this work. So it really will depend on the plan and the vision that each applicant comes up with, and then what are the relevant measures relate to that. The FAQ says that a grant cannot be used to expand a specific program or intervention. Does that mean that it cannot fund direct services? Or does that mean that the services must be new? Does this mean that we cannot apply for direct service or programming if it is intended to create healthy schools? And what do you mean when you say this is not a direct service grant? Okay, so this particular grant opportunity is not intended to just expand a particular intervention for a school. So, for instance, it's not intended to, we want to expand a nutrition program in all of the middle schools in our district. Important work to do, but really the focus of these grants and the initiative is more around what is really going to help create the conditions necessary to help spread healthy schools across a community. And that's a broader vision than just direct service and programming. So think of it as, you know, what are the system level changes that need to happen? Who are the stakeholders and leaders that perhaps need to be brought to the table to help move the needle on some of these issues? And while it's not solely a direct service grant, certainly as, you know, part of the efforts, we know that there need to be programs and strategies happening in schools. So I think it can be a part of the overall vision. It just can't be the sole work of this particular opportunity. So we would not fund applications that are just about, we want to bring this particular program or intervention to 5 additional schools. If it is about, you know, we want to build more public will about, you know, the importance of health and how it intersects with education, and for us that's really bringing more of our city leaders on board, or working with transportation and housing, or building more of a sort of, you know, public stakeholder campaign in our community around this. And in addition, you know, perhaps it lifts up some key strategies and programs. I think that's fine. It just can't be the sole focal point of the plan and certainly of the budget. Hopefully that helps. I know it's a long way to get around to get to that answer, but hopefully that helps. What types of policy changes or acceleration plan are you looking for? What action do you expect to see at a community level? So what we're hoping to see at the end of, you know, a 2-year implementation period is, are there new and different partners engaged in this work? Are you moving toward building more of a demand for healthy schools, so more parents understand the importance of what a healthy school environment is and can be, and want that for their children? Are young people sort of at the center of this work, and engaged stakeholders in not only, you know, understanding what a healthy school environment is, but really being champions and advocates within their own school to help build and maintain what that environment is? Do you have more leaders and decision makers on board that truly understand sort of really that holistic and integrated view of what a healthy school environment is, and can now be advocates for specific policy changes or, you know, budget implementations that help make it easier to foster healthy schools. So we're not looking for, a particular policy piece that, all folks have to work around. It really is based on your particular community context and what changes need to happen to really accelerate the existence of healthy schools in your communities. Do you envision relatively new, innovative programs being selected, or must an organization be tenured? I think if the proposal is compelling, that we're open to some more new and innovative programs and strategies. I think for us it's really more that broader vision and kind of collaborative approach to the work. So I think that's that's fine in whatever kind of form that presents itself in the community, whether at this for 25 years or new to this work, but have tested out some things and now want to accelerate that work. I represent a national organization that has 350 plus organizations in our network. Many in our network would be a great fit with this opportunity. Can we apply as a national organization? Do you suggest we submit multiple applications for multiple states? And what is the best proposal model for our application? So you cannot apply as a national organization, but love that this is an opportunity that you think will appeal to many of your members. I would suggest certainly, sharing it with your members in the eligible states and encouraging multiple applications from the multiple states. Yes, so hopefully that answers that question. In your general equity statement, you don't specify income levels or geographic isolation or proportion of students of color. Do you have thresholds for any of these, such as chronic absenteeism rates? No, we don't have thresholds. The equity statement comes from the equity definition that the Robert Wood Johnson Foundation uses, and we certainly know that each community context is going to be different and look different, and so really what you'll need to do along with your partners is really figure out in your community and in your context with your population and the challenges that you're facing. What does equity look like for you all on the ground? So what for you all, what are the most important elements when addressing equity? Is it geographic isolation? Is it the income level or particular students that you want to target? So and the equity statement we use is for the initiative and not the general one for the foundation. But really, I would implore you to work with your partners on this to really figure out, what makes the most sense for your particular community context. Will you consider supporting programs that take place in an after-school setting? Or are you looking exclusively for programs that are working with schools during the school day? Definitely we will consider programs in the after-school setting. We look at that as sort of an extension of the healthy school environment, so eligible as well. Can we work with multiple districts in several of the targeted states? Yes, you can. Can you give us an example of ideas that organizations would collaborate on to spend this kind of money? That one I am actually going to pass on just because I think we want to focus our answers on eligibility and particular questions around the application without getting into sort of the content and the meat of particular ideas for the funding. Can a portion of the grant go toward programming? So yes, so I think in my roundabout answer earlier on, can't be the sole focus point, but certainly as part of an overall effort, yes. Are you looking for community collaboratives to do rigorous evaluations of their collective approach as part of this grant? And if so, do you have a particular level of rigor you would prefer? No, we are not looking for applicants to do rigorous evaluation around their collective approach. We know there are lots of different frameworks and models for collective impact. We're not making any judgment on how folks have structured their collaborative and partner efforts. We just want to know they exist and have a little context on, how they've been working together and the work that they've been doing to date and the plan for moving forward. But there'll be no expectation around rigorous evaluation of that collective approach. And will this funding be able to be used to support an existing program at a single site? Yes, again, as long as it's not the sole focal point of the entire effort, but if it's a piece of the broader effort and you've made the compelling case of not only how it would support that single site, but also help kind of move the needle on some larger work that you're trying to do as part of this effort in the community, that would be fine. What are the evaluation requirements for the initiative? Should this be a certain % of the budget? There are no evaluation requirements in terms of, allocate 10% of your budget for the evaluation. As part of this funding opportunity, each grantee will be a part of our kind of cohort of grantees learning community. And so part of this is not only to fund specific communities to move your work along at the local level, but we actually want to learn from your efforts at the local level to help inform a broader national audience. So think of this not as a funding opportunity where we give you a grant check and ask for a couple of reports over the couple of years, but we really want to partner with you all to learn what this actually looks like on the ground, what it takes to move the needle on these issues, and get that out to a national audience to help shape a national movement around healthy schools. But no, you do not have to allocate a percentage of your budget for evaluation efforts. Is there a minimum % of an organization's budget that you expect the $150,000 to represent? In other words, is there a minimum organizational budget level you expect? No, there is not. We don't have any requirements around, only entities with a certain level of budget can apply for this. Are there certain schools in each state that are the available choices to work with, or are all schools in each state eligible? That's a great question. We'd say that all schools are eligible. However, I will point out, with our focus really squarely on equity for this initiative, we would hope that communities really take that seriously in terms of targeting which districts, which schools they want to work with. We're really interested in how we can move the needle on this issue, particularly for the students, the families, the communities, in the most challenging circumstances. So, can multiple organizations apply for different grants partnering with the same school district, as in potential competing programs? Sorry, I'm just trying to understand the question. You want to take a stab at that?
Multiple organizations. Yeah, I don't think we would preclude organizations from being partners on multiple applications. It's I think that's totally fine.
All right. Is there any preference given to communities already receiving RWJ grants, such as Culture of Health, or would this be seen as a duplication of efforts? It definitely would not be seen as a duplication of efforts. Again, we know there's already great work going on the ground. We know RWJ has indeed funded a lot of this work. So no, as long as applicants can make the case of how this builds on, work that you're already funded for, that's fine. Now, will preference be given to those communities? We do not know. We don't have that built into our review process, but certainly eligible to apply. Can one school cluster include both charter and public schools within the same district? Yes. Can we work with public charter schools as part of this application? Yes. Are applicants required to target multiple health outcome areas, or is it okay to focus on 1 to 2 areas? Another great question. It is okay to focus on 1 or 2 areas. Again, this is really taking a holistic view at health and well-being, but we know that each community and each district is going to be at a different phase of this work. And so, some folks may have started in a couple of areas and then want to use this to accelerate work in a couple of different areas, and that's absolutely fine. Don't feel that you have to come with a plan that addresses, each area of the WISC framework. Is the budget broke down as to how money must be spent? Example, meetings, travel, action plan, stipends. We do have some categories in the budget worksheet and sort of the wonderful other catch-all category. There are others that don't seem to fall in those, but we did try to make it as easy as a template as possible for folks. Can you please describe how you define direct service and what is allowable? So we're defining direct service as a particular program that works directly, with young people. So a exercise program that is going to work with 40 middle schoolers. That's what we're thinking of our definition of direct service. And so in some of the other questions, I think I've addressed that this funding opportunity, not solely for just funding those types of programs. However, in the context of the broader vision, that will be allowed, just not the sole focus. What is an appropriate admin overhead percentage? We have 15% allocated for overhead in the budget. Is equipment and furnishings for new school-based health centers allowable items? Do these need to be non-medical equipment only? Yes, again, allowable items. Make sure that it's all related back to your broader purpose and goals, but yes, allowable items. How would we be reporting on the funding part? So if this is a question that's about sort of required grantee reports is what I'm gathering. There will be, once applicants are selected, there'll be a grant agreement outlining grantee reports that are required, but think of it as annual reports and perhaps mid-year. These are written, narrative reports, expenditure reports. Again, we really do look at this as an opportunity to partner with the grantees. So in addition to formal written reports, really kind of regular communications with America's Promise and our core partners so we can learn together in this initiative. Can funding be used to partially hire staff to lead the collaboration? Absolutely. Could this expand an existing program into more schools, from 4 schools into 8 schools? It could, but again, can't be the whole focus of the grant. Part of the grant, that's fine. Is this a new fund, or are there past awardees so we can see examples of programs funded in the past? This is a new fund. This is a new initiative for the Robert Wood Johnson Foundation, and so this is a new fund that America's Promise is launching. Given that the 2 of the core partners are Child Obesity 180 and Food Corps, will proposed projects with a food nutrition component be looked on more favorably? No, they won't be looked on more favorably. We carefully chose these 5 core partners really based on their expertise and the lens and the work that they do directly related to the WISC model. So that's why you see the diversity of partners that you do. But no, if your grant focuses on food and nutrition, no bonus points there. Sorry. Let's see, my statement about national organizations being ineligible. If we work nationally with districts across the country, is it permissible to apply to work with several districts across multiple target states? So, if the national organization is the only organization that is the best lead of the project in these states for the districts that you're targeting, I suppose a case could be made for that. I see no problem with a national organization being part of the partnership and part of, the collaborative groups at the table. But I think, while perhaps not ineligible, the national organization would really have to make a compelling case of, why they're the lead organization as opposed to one of the, local organizations. So thank you for the follow-up question that allowed me to amend my answer. Would these funds be able to help build a gym for a church for after-school programs that will be starting in January? Or is this just for a school district? So I would say that that would probably be a hard case to make for this particular grant opportunity. It really is about schools being the hub of the community. Again, I won't say, that you can't put forth that idea. I would say on its own, it probably will not go far, but if it's, part of a larger effort that involves the schools and school districts and lots of other partners, that could be part of the plan. But on its own, probably not the best fit for this particular grant opportunity. Do you expect applicants to select one core partner or more than one? So you should at least have one, and more than one is better. Again, we see this as it's about healthy schools, but we know to really make that a reality, it takes all sectors, all different types of groups. But if you have multiple partners, you could do one commitment letter that all of your partners, sign. So at least one partner, but definitely multiple partners from different aspects and different lenses of this work would be great. A question of asking again how many grants we will be awarding. We'll be awarding 3 to 5 grants. Is it better for a school district or community partner to be the lead? For us, it doesn't matter. We've written this to invite both school districts or community partners to be the lead. We're not going to look at, oh, this is led by a school district, so it's better than one being led by a community partner. So we wanted to make sure that we left it open that way. So we're not looking more favorably on either one. Can America's Promise connect us to potential partners for this grant? And what information do you need to make matches? So that's a great question. I would say if you could email us so we can get, more information, where you are, what organization, what types of partners you're looking for. And I think certainly as we get inquiries and interest, we're not taking, for instance, there's not a letter of intent that's required, so we won't know sort of the full swath of folks who might be interested. But if you email us with information, we can certainly try to connect you from what we know and find out. Can the letter from the school district be from a school board member? Good question, and the silence is us thinking. On that one, let us think about that, and if you could follow up with us via email, healthyschools@americaspromise.org with that same question, and we'll follow up with you offline. That would be great. What is the average grant size per year? So the grant size is up to $150,000 per year. So that's the maximum size per year, with a $300,000 total over the 2-year period. Will you consider Native tribal schools as district schools? Absolutely. And yeah, again, wanting a diverse portfolio, encourage applications that involve Native tribal schools. Does a school have to disclose their current grants they're receiving? No, not at all. Now, I would say if they're receiving grants that are really relevant and related to this Healthy Schools work, it'd be great just to know that as part of your application, then because that gives us the indication of, continuing on with the work, leveraging the work that's, schools are already doing, but they're not required to disclose the grants that they're receiving.
And we only have time for one more question, and that is the 3 to 5 grants including all the states or 3 to 5 per state? And the answer to that one would be it's 3 to 5 total, and we'll be pulling from all states for those final 3 to 5 grants.
I want to thank everyone for joining us. If we did not get to your question and you want to make sure you get an answer, I encourage you to email us at healthyschools@americaspromise.org. Thanks for the wonderful and thoughtful questions. As Nico said, we will be updating the frequently asked questions document on a regular basis, so you really should visit that throughout the process. And we hope that we'll be getting many applications from many of you. Thank you so much.